Sorry, power barely has corrupted. So principles of medical management continuation, what I said earlier, we require prolonged antibiotic in high dose and it should be bactericidal. Slow high dose because as you know it's slowly metabolizing bacteria due to high density and it's lead to low sensitivity of antimicrobials and deep inside vegetation. So as I said earlier, it should penetrate. Therapy. So uh, we usually empiric therapies we offer Kepraxone 1 gram depends. Okay, one will say Kepraxone. But once we have in a targeted therapy, that is once organisms are there, depends on that we may target the therapy. We may guide the therapy. So for Streptococcus and Enterococcus, we have to determine the minimal concentration of penicillin. We use undo yeast and we often penicillin. Maybe it's sometime we may add in aminoglycoside like gentamicin or Kepraxone along per se enough, but Enterococcus it's inherent resistant. We can't treat with Kepraxone. We have to go ampicillin or vancomycin. As a group, it's Kepraxone or cefotaxime. Kepraxone is preferred. It's give 12 hourly or daily dose later. Cefotaxime, we have to give 8 hourly dose, TDS. Staphylococcus, native val, whatever, flucloxacillin. If it is MRSA, vancomycin, we may add plus or minus aminoglycoside, but adding vancomycin and aminoglycoside is a highly nephrotoxic. So we try to avoid such. About prosthetic valves, same. So you can see about the antibiotics and MICs, but you don't know much, but get the idea what is the duration is there, 2 weeks. Right-sided endocarditis, usually we give 2 weeks, but other you can see 4 to 6 weeks, 4 weeks likewise, okay. Surgical therapy, once one way, if it is not responding, because here also we can monitor the response with CRP as well as weekly ESR. And time to time, once in 2 weeks or in 4 weeks, like we can do repeated echocardiography. And same time, clinical response is very much important. But if it is patient is not responding, what we have to do is we have to go for the surgery. And meanwhile, we have to think about the complications. If it is patients is having congestive cardiac failure, perivascular invasive disease, likewise large vegetation, major embolus, heart block, we go for the surgical therapy, cardiothoracic opinion. The hemodynamic status at the time determines principally operative mortality. So it's cardiac. So it's there just to get idea. For the sake of completion, I put heart failure, uncontrolled infection, prevention of embolism. Prophylaxis, that's the other topic. Pathogenesis of infective endocarditis is presumed to involve the following sequence of events. Formation of small thrombus, secondary infection, and proliferation of bacteria result in formation of vegetations. So, since the occurrence of bacterium is crucial to the initiation of episode of infective endocarditis, so bacteriemia, we have to prevent. That means once bacterium is there, if antibiotics is in the blood, so it prevent that particular bacteremia or kills the bacteria and prevent reach to cardiac valves or heart. So that's why support antimicrobial prophylaxis. Patient with high-risk medical condition undergoing procedure like to result in bacteremia. So who's having murmurs, who are undergoing dental procedures, we are offering. There are high-risk conditions, persons, patients with prosthetic heart valves, prior history of infective endocarditis. So unpaired cyanotic congenital heart disease. Just get idea. Don't recall much. Valve regurgitation due to structurally anomal valve in transplanted heart. So we often high risk conditions we have prophylaxis. Similarly, this is very much what you have to know. Dental procedures, that tinil manipulation of gingival tissues or the periapical region of the teeth or perforation of the oral mucosa. That's what you have to know. Then respiratory keyhole incision biopsy of the respiratory mucosa. There are arguments. So dental procedures, we often give amoxicillin. That will be enough. So amoxicillin, maybe ampicillin, penicillin allergy, clarithromycin. That will be enough. So clinical points you can recall. This is the summary of like. So based on this, the treatment modalities. Thank you.